Dr. Barry Gordon is actually going to get his daughter married out in Ohio, so he's off today. But I do have a very, very special guest. Dr. Heather Auld is joining us from our Southwest Florida Integrative Medicine office, and she's an amazing physician, and we're so lucky to have her on our side. She's OBGYN, she's integrative medicine, she's pro-cannabis. I think today's episode is going to be really special. It's breast cancer awareness, as many of you know. And so for all of us, I think all of us have been touched by somebody who has had cancer or is going through chemo at this point. A true very good friend of mine just was diagnosed recently with breast cancer, and she's going now through a rigorous chemotherapy treatment, and it's so difficult to watch somebody going through that. And everything that we can do as women, from diet to exercise to taking care of ourselves and each other is so critical. And I'm going to let Dr. Auld sort of give herself a bio, and then we're going to dive into women's issues and cannabis use and alternative medicine. So I'm going to open the floor to Dr. Auld because she is much, much better at this whole topic than I am. She's truly an expert. So Dr. Auld, the floor is yours to do an introduction, and we'll get going into a conversation about medicine and cannabis in women.
Yep. Good morning, Ruta. Thank you for having me. Breast cancer is near and dear to my heart. As a practicing OBGYN for over 25 years, I've had to give that message to many women. And it's very frustrating when they feel like helpless. And we can empower women. After I did my 25 years, I went and did a 2-year fellowship with Dr. Andrew Weil in University of Arizona, Integrative Medicine. And it changed the way I practice medicine. And actually, I felt that it empowered not only me, but all my patients in taking a proactive way of life so that they can help prevent chronic diseases. And even breast cancer is something that can be affected by lifestyle changes.
Which is amazing. So I know that at your clinic in Fort Myers, you have a vast array of like different kinds of supplements and vitamins that you utilize, and you do look at a holistic approach to medicine now. And I think as women, and I think even amongst my girlfriends, when we talk, I think women are a lot more open and a lot more willing to try a holistic approach to medicine. I think like sometimes like I talk to like whether it's a husband and friends that are males, they're kind of like, yeah, whatever. But for the women, I think they really do want to look at the whole body approach, and they're looking for alternatives that are healthier and actually take care of the body a lot more. So tell us a little bit of how you utilize integrative medicine in your practice.
Well, let's talk, specifically about breast cancer. Women are the caregivers of their families, so it's within their power to really kind of drive the nutrition aspect. And sometimes the men follow reluctantly, but there's several things to know. But only 10% of breast cancer is genetically driven. That means that there's 90% of women that get breast cancer don't have the genetic predisposition. So why is that? We are in a society that we are bombarded by endocrine disruptors, which is the world full of plastics. The plastics have been very full of what they call BPAs. So they mimic estrogen, and often the wrong kind of estrogen, the more inflammatory form. So it's very important to know that if you can get something in glass, yes, do that. Also, the food that you eat, cruciferous vegetables, what are those? Those are the cabbage, the kale, maybe even cannabis, the broccoli, all those are called cruciferous vegetables. They contain a specific compound called indo-3-carbinol, which is very protective against breast cancer. And so the more you eat your veggies, the better chances that you may be able to fight off or not even get breast cancer. But other foods like dairy or red meat or other foods that are like junk food, that has like put in plastic containers. Those foods actually can increase your risk for breast cancer. And why dairy? A lot of people like to eat the low-fat dairy. Well, actually, higher fat dairy is less likely to cause breast cancer than the low-fat dairy. And the reason is that when they spin the dairy products, the endocrine disruptors or the estrogen containing component of milk rises to the top, and that's what gets.
Uh-oh. We can't hear you. Hold on. I think we lost the mic.
Are you better?
Yeah, we're back.
Okay, that was just me knocking everything off. But anyway, long story short, the skim milk contains a lot more estrogen than full fat milk.
That's not really like well known, is it? I've never heard that.
No, it's not. And there's not a lot about dairy that is really healthy for you. If I had to say two things for lifestyle change for women, I would say try to avoid dairy as much as possible. And the other one is do not use antiperspirants. Antiperspirants are one of the big ones because they contain the parabens, and the parabens actually turn off your BRCA gene. Your BRCA gene is actually a good gene that actually is your gatekeeper for your breast, and it grabs cancer and kills it before it becomes. So when you use antiperspirants, it deactivates the BRCA gene from being able to be the gatekeeper. But guess what? If you eat whole soy, organic whole soy, it can turn that gene back on, the gatekeeper. So, eat real whole soy, not soy protein powders. Those are not what we're talking about. And use those natural deodorants. You may sweat a bit, but it's a lot healthier for you.
A lot healthier, honestly. And if it's, to any woman, I'm sure she'd much rather have a little sweat than, have breast cancer. And for the dairy, my question is, and I'm sure some women out there are listening. So, women also suffer a lot from osteoporosis and bone density loss. So with the lack of dairy, if you're saying to take out dairy, would you suggest then taking just supplements at that point? And as an alternative?
Well, it doesn't mean that you don't need calcium, but I think there was a very good propaganda campaign that milk does a body good for your bones. If you read two extensive studies, one was by the British Medical Journal and the other one is by the JAMA. One was 20,000 studies and one was 30,000 studies. The incidence of hip fracture was directly proportional to the amount of milk consumed. So yeah, I'm telling you the opposite, that actually dairy can increase your risk for osteoporosis. And how does that do that? Yeah. It doesn't mean you don't need calcium.
That's incredible.
Well, and the reason it is because there's a sugar in milk called galactose that's naturally occurring. It's not sweet, but it's a galactose. And that seems to be the offending participant in that it's directly proportional to hip fractures. Now, there is one exception, and that is full fat Greek yogurt, with no added sugars and things like that. Now that does not seem to, because when it's fermented, it ferments that sugar out.
And same thing then, like, I assume like if it's like butter and things like that, is it better than to go to like an olive oil in that?
Well, butter really doesn't have very much other than fat in it. So I don't really count butter as a dairy product as much,
So my question is also like, for women's health, especially like you said, I think this is wonderful information. And in fact, I'd like maybe at some point if you can write something up, and I'd love to put it on our webpage and put it out on Facebook, because this is information that really is not readily available. And I think it's critical. And I think for women, this is groundbreaking for me. I just listening to you today, I'm like, wow, there's a lot of things that I want to change now myself, just because like you said, the propaganda is like, oh my gosh, I don't drink enough milk. And I'm like, oh gosh, I need to have something like get a glass of milk and I don't even like it, but I'm drinking it just thinking it's better for me. And it may not be.
Well, the oat milks, the flaxseed milks, the cashew milks, the almond milks, they all have calcium in it that are good substitutes. So dairy sources of calcium are good.
Okay, that's good.
So I know that we got off the tangent to osteoporosis, but it all is part of women's health, you know?
Women's health. And I think that everything we talk about today is going to be cohesive in women's health, and it's a great
Mhm.
topic. My other question is like, so what about mammograms? Because I know that there's been like, some people are saying you don't need them every year. Some people are saying you do need them every year. So like, I mean, there seems to be a lot of misinformation even about mammograms. And so I want to hear your take on getting them done.
So there is kind of an ongoing disagreement between the American College of OBGYN and the American Cancer Society. So the American College of OBGYN still says yearly mammograms. However, in my practice, I have many people that want to be very holistic and don't want to have the radiation. And in those patients, we kind of alternate between thermography one year with no radiation and then mammograms other years. I will also say that, you know, the amount of radiation in a mammogram is about 1/7 of a chest x-ray. You get one rad going just flying across the country. So you're going to get 1/7 of a rad from a regular mammogram. Now the 3D mammograms, you're going to get a little bit more, but you're also going to get a lot more information. So the amount of radiation is not great. Cumulative, is it something to think about? Well, yes, because sometimes people have to get called back for other views and things like that. But the gold standard is still the mammogram, and I side with the American College of OBGYN at yearly testing, whether or not it's thermography or mammogram.
Yes, you do. Because I know there has been a lot of debate, and I like I said, I know even amongst my girlfriends, some of them are like pro mammogram, some are like, oh, I'm gonna get one once every 5 years, and I'm like, I don't think that's very smart, but I agree. I think you have to be proactive on that. I want to touch a little bit now about cannabis in women, because a lot of times, like, uh, it's interesting, like in the practice here at Dr. Barry's office, we have predominantly female patients. I think we're like around probably a little bit over 65% of our patients are female.
Mhm.
Tend to be over the age of 40. So it's sort of an interesting dynamic again, going into the women seem to, as we get older, we want something as an alternative medicine. And we look for it even in cannabis for pain relief, for sleep, for anxiety. And I just want you to touch a little bit about, touch upon that in your practice and what you've seen and what you recommend for female patients.
Well, you're exactly right. The same as in my practice, predominantly women. Pain and insomnia are really big factors, and a lot of women do not want to smoke. It's preference, and I do often recommend tinctures in various amounts. Now, you know that the tinctures can be THC or CBD or a combination and different ratios of that, and you have to really tailor it to each patient, because sometimes women have anxiety along with that, in which case they can't turn their mind off at night. Also, they want to decrease inflammation, you know, the autoimmune. We do know that cannabis is very good at quieting autoimmune disease and maybe helping it go into remission. And so in those cases, you really need to get both your THC and CBD. Likewise, for anxiety, going to sleep at night, you need both CBD and THC. Sexual desire is also a big problem for a lot of women, especially as they get into the menopause years. And that can really help relax women and can increase sexual desire. Too much is too much, but there's just a little sweet spot there, and every woman has to find out how much they need to take.
I think that's one of the questions too. I find like even amongst friends of mine, they're like, "Well, how much do you know? How do you know what to take or how much to take?" And they get a little bit apprehensive about it just because the dosing, and they're not sure, you know, what to do and how to take it. And so maybe you can address that a little bit, and how you go over the products and things like that with your patients.
Well, right. So a lot of women, it's not the same as writing a prescription for a pharmaceutical, because we have receptors for our entire body, and our body, each one of us responds differently. So we always err on the side of going low, and then having them, empower them to build up as they need to, and also change it up very easily, because it's the terpenes that seem to drive the properties. So it depends on what their chemical makeup is. So I don't know if I gave that, it's kind of an indirect answer, but you never want to start high, because too much cannabis can actually either just put you to sleep or can make you feel uncomfortable. Whereas if you start low and you just build on it. But again, sometimes if you, let's say that you have an autoimmune, you want to keep it in your system because it's very anti-inflammatory. You have to give it a chance. So by keeping it in your system and layering it, you can actually achieve really great results for inflammation, especially when women are going through like chemotherapy and I'm talking about for breast cancer now. We do know that cannabis can be very helpful for that. But I do want to mention one thing about that, is that I do feel that the raw cannabis is probably going to be way better in our women that have breast cancer. And that's why it has so much more THCA and CBDA, and especially women that have those advanced cancers that, and they're on something like Herceptin, that won't cross the blood-brain barrier, but the THCA and the CBDA do, and they may have potent anti-cancer effects. Now, I'm not saying use cannabis as an alternative to your chemo, but I think that it can really offer some distinct advantages. And it depends if you're getting active chemo or if you're getting immune therapy, what you would take. CBD can interfere with that. So each patient has to be individually dosed and also recommended, because it really depends on what kind of cancer they have. If it's an aggressive cancer, if it's a estrogen receptor positive cancer, you want to do the regular run-of-the-mill stage 1, non-aggressive cancers. You want to keep your THC between around 25 milligrams, but certainly no higher than 50 to 100 milligrams a day. So that's about as close as a dose as I'm going to give you.
No, and it's really important, because like I said, I think a lot of women and cancer patients in particular too, they're looking for relief, and obviously, like you said, it depends on what kind of cancer and how aggressive it is. Can you touch a little bit upon like RSO use? Because I know a lot of people toss that around and they're like, oh, if you have cancer, you should just go directly to RSO, for pain relief or nausea relief. So can you touch a little bit about that?
Certainly. So RSO stands for the Rick Simpson oil. And, Rick Simpson was that engineer up in Canada who actually made his own first concoction out of the whole plant, and he put the oil on his skin and essentially cured himself from his basal cell carcinomas. So he then has continued to offer that to patients suffering from cancer. And it's not just the skin cancers we're finding out. So the RSO is available now in a tincture. Before it was mostly just a resin, but the tincture form, which is like phenomenal breakthrough, is really good for our older patients who really find that the resins or the concentrates are too cumbersome to work with. So the RSO has the full 400 compounds that the whole cannabis plant has. And there's something about that seems to work much better for pain and also for relief of insomnia, and also we may have some anti-cancer effects, but we're not exactly certain how that might work. I'm not going to say that it's going to help with your breast cancer, but certainly, the pain and the nausea and the deep bone pain that you can get is tremendous relief. So the difference with RSO as opposed to other tinctures is that it's not just CBD and THC, it's the full complement.
And then as far as like for a lot of women who are going through chemotherapy, there's obviously a lot of weight loss, lack of appetite, in some cases depression. So
yes.
And we've seen that in the clinic here. So again, with cannabis, are you seeing good results for those people?
Yes, and I would say for those that are actively going through like IV chemotherapy, it's probably better in those patients to vape. Now, why am I saying that? Because we don't want to interfere with the chemotherapy. We don't want it to go through the liver. We want it to go into the lungs and be absorbed directly into the bloodstream that way. So you can get a pretty quick relief from nausea and from pain. And when you aren't nauseated and you're no longer in pain, that goes a long ways in itself to relieve depression. But also it's relaxing and it decreases the anxiety. And I think that the different modalities are really important to have all of them.
No, I agree. Touching back on general women's health, again, because you do integrative medicine, and I've come into your practice as a patient, and I found it incredibly rewarding. And it opens your eyes, I think, to looking at things differently, like from foods to your lifestyle to everything. Just can you give us an experience of, like, say, if a new patient walks through your door and she's coming in and she wants to try something new and a new approach, and I actually have gotten several questions about people asking me, they're like, do you know an integrative doctor? I'm like, yes, and she's in Fort Myers, and they're like, it's a little far, but they really are searching for this. And so I want to sort of give an explanation of what happens when you traditional doctor, because it was a very different experience for me coming into your practice versus the traditional MD setting, where it's like, how are you feeling, blah blah blah. You go into so in depth into so many things, and the lab work that you run and everything. So can you give us a little bit of insight?
Sure. So the typical patient, when they make an appointment for an integrative visit, we send them a packet, and unfortunately it's almost 12 pages, but we want to know everything about you, and you get to give us your top 3 goals, because this is about your journey. What are your goals? What do you want to see happen with this visit? What do you want to have changed in your life? And it's not just, check your blood pressure, check your weight and say goodbye. So we also want to know, we have a 3-page diet history. We want to know, what do you eat typically? This is not a time to pretend that you eat perfectly. We want to know exactly what you do. I mean, are you one of those Coke fanatics? I mean, I'm talking about Coca-Cola. We know that that's not really the best or the healthiest choice. It's not even considered a food. So we want to know that. But then we want to know what's going on in your family history. What's your typical day like? And also, even though they have these top 3 goals, which anxiety, insomnia, pain are usually our top 3s, in addition to hormones, hot flashes, those are also big. But we want to know, what are your bowel movements like? How often do you go? Do you have pain elsewhere? What else is going on? So we ask specific questions about people that they're not even listing as their top 3 goals, but it really may have a big impact on the rest of their life. And so when we do that, we let them tell their story. I find that if you sit back and you really listen to somebody without interrupting them, and they tell their story, it makes my job so easy, because I can then often know right then what's going on with them, what their issue is. And, they're kind of letting me into their mind. And also that is so important, because it's not just a lab test. You have to really meet the person where they are and know what their goals are, and then help them and guide them. I say that I'm just the rudder, it's their journey, and it is making lifestyle choices and changes. And, it depends how willing somebody is. So if somebody says, hey, I'm all in, oh, you believe it or not, we can make you all in, and we can really kind of hammer it and go at it quickly. But if some people say, well, let me just try this first. And that's fine too, because any little change that you make is really important. I want to say one more thing about breast cancer, because I know we're going to run out of time, but I'm going to give you the top main things that women can do to help protect themselves from breast cancer. One is to keep your body at a normal weight. Watch what your calories are doing. And make sure they're healthy calories. The other one is intermittent fasting. We don't know about, but 13 hours of intermittent fasting for women actually dramatically can reduce the incidence of breast cancer. We don't know why, but it does. It really does. Really avoid junk foods. So sugars are inflammatory. So I tell people, look at everything that you put in your body and say, is this inflammatory? Is this not inflammatory? And when you do it that way, rather than saying, I want to lose weight or I want to gain weight, if you do that, your body will get to the weight that it needs to be. So, a wild caught fish, don't eat farm raised anything as far as fish goes. And then you want free range meat if you're going to eat meat, but your meat should be smaller portions of meat, and mostly you should eat your fruits and vegetables. Now, specific fruits that are very high in antioxidants are so important. I think raw cannabis is an antioxidant as well, and it also has the phytonutrients that are very, very important. But strawberries and mushrooms, portobello mushrooms have been associated with a decrease in breast cancer. So mushrooms are going to be the very next place that's going to be the new frontier. And one last thing is limit your alcohol. Alcohol, even one glass a day may be okay, but more than that can increase. Why does that do that? When you drink alcohol, it bumps up your estrogen. It makes your liver produce more in your liver. It doesn't detoxify estrogen. And so that's what I'm going to say about that.
Honestly, I hope everyone that's listening is taking notes. I would really like at some point, if you have the time, I know you're extremely busy, but to sort of write a little bit of what you said, and so we could post it. I think it is so important. I think so many women would really appreciate it, just because you don't hear this all the time. You really don't. And if you go to a traditional doctor, they might say, okay, like you said, okay, lose some weight or whatever, but they're not going to go into a lot of detail of what's really good for you and what can give better results for not getting breast cancer. And I think we owe it to ourselves, our daughters, our mothers, our aunts, all the women in our family, because they really are the ones who lead families, and we need to take care of ourselves and our female counterparts. And again, if you could ever write something up, I think it would be wonderful. Give a plug for your clinic if anyone and make an appointment with Dr. Auld. Let me just tell you, you would be very fortunate to have that appointment. You'd be really blessed and happy with that. Give us how we can get in touch with you.
Well, we're at 1570 Colonial Boulevard in Fort Myers, and our office number is 239-208 6676. We welcome everybody. We do take care of men as well, integrative wise, in addition to doing gynecological females. I do that as an OBGYN still, but our cannabis, it all dovetails, because I have patients, the same person that's in all three categories in our office, because it isn't just about taking a pill. It isn't just about smoking this. It's about what we can do to make our own cells healthier. And, we give the power to you.
So thank you everyone for tuning in. Thank you, Dr. Auld, for an amazing half hour of information. It's always so beneficial to hear from you. And we will post everything up on Facebook Live. We'll also put Dr. Auld's phone number and information up on there as well. So for those who would really like to get in touch with her, we'll put her information. Thank you again for everything you do. And we hope to have you on again, obviously, soon. So
Well, thanks. Thank you for having me, and you have a good day.
you. Thanks, everyone. And we'll see you back next week with Dr. Barry next Thursday at 8:30. Take care, everyone. Bye-bye.
Bye-bye.